His second webinar. We're very excited tonight because we're living in very challenging times, and now we have an answer to our prayers, vaccines. So Dr. James Meegan is a virologist who recently retired as a director of the Office of Global Research in the office of Dr. Anthony Fauci at the National Institute of Health, NIH. There, he was responsible for coordination of over $400 million of international research activities. Prior to this, he had a long scientific career specializing in global health, emergency diseases, and vaccine development. He has participated in the control of epidemics caused by Ebola, influenza, Zika, West Nile, dengue, measles, and yellow fever viruses. He's received his undergraduate degree from Holy Cross College and his PhD from the University of Connecticut. Early in his career, he held research positions at the University of California, Berkeley, Yale University Medical School, and at various U.S. military research institutes. He additionally has held leadership positions at the World Health Organization in Geneva, the NIH, and within the biotech industry. Dr. Meegan has many distinguished awards, including the WHO Directors Award, the NIH Directors Award, the NIAID Directors Award, and the Secretary's Award from the Department of Health and Human Services. He recently served as Senior Embassy Science Fellow at the U.S. Embassy Brussels, Belgium, and at the U.S. Embassy Paris, France. He has published numerous scholarly manuscripts and has been a consultant and advisor to numerous individual countries and scientific groups. He will be answering your questions concerning coronavirus, vaccines, and related topics. And I have a few that you have emailed me, and please feel free to type in questions on the chat line as we go forward. And the first one is from Stephanie. With so many vaccines and different chemistries, maybe I mean methodologies, being developed, are people going to need vaccines themselves several times? Once with a kind of chemistry, then maybe sometime a month or so goes by, and then vaccine again with another kind of chemistry in order to get protection? Maybe like a Trojan horse technique for the vaccine, like one part is attacking the virus and the other part is preventing the virus spike from occurring? Can we realistically inoculate ourselves several times over the course of the year in order to get maximum protection, as some of these techniques might be more effective than others? At one point, will that occur during the virus? Like, when will the standardization happen? Jim?
I'm glad we started with an easy question. First, I'd like to say that thank you for inviting me again. This is the second in this webinar series, and some of you might have caught the first one. This time we're just going to do questions and answers because we have quite a few of them. And I should mention that I'm not a physician, I'm a PhD, and I'm not giving any medical advice. Always go to your own physician to get medical advice. So this first question by Stephanie relates to the different types of vaccines. So there are 2 and almost 3 vaccines available. The first 2 from Pfizer and Moderna are messenger RNA vaccines. So that's a classification of vaccine. The one from Johnson & Johnson that you've heard about recently is a different type of vaccine. It's an adenovirus hybrid vaccine. So all the research that has been done by the companies has been their own vaccine followed by a booster for Pfizer, their own vaccine followed by their own vaccine as a booster for Moderna, and only one shot is needed for the Johnson & Johnson vaccine. So the only data we have that shows effective immunity is if you stay with the same vaccine. Stephanie was thinking that since they're different chemistries, mRNA in one case, and adenovirus hybrid in the other, that if you alternated them or took both of them, you might broaden your immune response. It's a good thought, but we don't have any data on that right now. So the recommendations right now are stay with the type of vaccine that you got originally. I think most people will end up getting Pfizer or Moderna. Those two are probably interchangeable, but you're still better to stay with the one product. The adenovirus Johnson & Johnson that hasn't been approved yet, maybe tomorrow or the next week, is a totally different type of vaccine. Let me just spend 1 second on what a messenger RNA vaccine is and what an adenovirus hybrid vaccine is. They're both new types of vaccine technology. Old technology was to take the virus, grow it up in large vats, put formalin in it and kill it, and then give that killed vaccine to you. Or grow the virus multiple times, in which case it would slowly attenuate and become less and less virulent, and then give that live attenuated vaccine. Polio, Salk and Sabin are examples of that. One was killed, the other was a live vaccine that you took on a sugar cube or orally. That's the older technology. The newer technology with messenger RNA, they take the RNA from the virus and put it in little tiny lipid or fat cells to protect it, little bubbles, and that's the vaccine. They inoculate it into your arm. The RNA attaches to cells, gets into the cells, and in the cytoplasm starts making the virus spike protein. That spike protein is transported out of the cell, and your body says, whoops, this is a foreign protein, I've got to make antibodies to it. The messenger RNA slowly decays over a period of 2 days to a week and falls apart. RNA is very, very sensitive to enzymes in the cells. So that's a new technology, has lots of advantages because you can make it quickly and you can change it quickly, and that's important. Johnson & Johnson took a virus that many people have already seen, adenovirus. The classification of adenoviruses are one of the classifications of viruses that gives us the common cold. So it took that virus, took parts of the adenovirus out, and put the spike protein from coronavirus into it. So now you have an adenovirus, but on the outside of it, you have spike proteins from coronavirus. That particular virus doesn't replicate, but that's what the Johnson & Johnson vaccine is, a hybrid virus, a chimera virus, they often call it. And that's inoculated into you, gets into your cells, and the DNA of that virus replicates and makes the spike protein. It gets transported out of the cell. Your body recognizes it as foreign and makes antibodies to it. So those are the two vaccines that we have. Those are the new methodologies, both of them brand new. And like I said, probably not, we shouldn't mix them as Stephanie was talking about. There are other questions. Will we need more than one vaccine? That's a great question. Will we need a booster? We don't know. We've only been giving the vaccine since July, so we don't know about long-term duration of our antibodies. We just are going to have to watch that. I wouldn't be surprised if we needed a booster at 1 year or 2 years, but we'll just have to see how the data comes along for that. Over.
Jim, I have a question from Rosemary Dwyer. 2 weeks after both people have received their second shot, is it safe for them to be together without wearing a mask?
Okay, so this is a central question as well. When we've tested the vaccines, we know that they protect against death 100%. Test each of the vaccines. We know that they protect against severe hospitalizations, and we know that they protect against regular clinical disease. That's the figure you hear about. 95% for Moderna and Pfizer, and about 70% for Johnson & Johnson. That's for the ability to protect against disease, recognizable symptom disease. But they all are very good. Even the people who get, for example, with Johnson & Johnson, if you have 100 people, 70% of them don't get any disease. The 30% that do get clinical disease never progress to a severe disease or die. No one's died from coronavirus after receiving the vaccines yet. So keep that in mind when we talk about 95% and 70%. That's clinical disease. It actually gives you extra protection beyond that for severe disease. So can we, if you're sitting with your husband or your family and they've all been vaccinated, the current thought is that you probably do not need a mask in that case. If someone comes into the room who isn't vaccinated, that's a different story. Why is that? Because when you get the vaccine, we don't know yet, but we're worried that when the natural virus comes and you're exposed to it, it'll set up a little bit of infection, a coronavirus infection in your nose. You won't even know it, you won't have symptoms, and your antibodies will kick in and protect it. But for a short period of time, you might have a little coronavirus that's replicating in your nose and coming out. So if that person, so even if you're vaccinated, you might be replicating it just a little bit. We don't know that. We're going to have to watch it. We're hoping that you don't, but it wouldn't be unusual to see it with respiratory diseases. In that case, even though you're vaccinated, if you had picked up the native disease at the store when you were shopping and you came home and you took your mask off with a whole bunch of people who were vaccinated, there is a theoretical risk now that you could give that the virus to them as it replicated just a little bit in your nose. Very unusual concept to grasp there, but it's very, very possible. So the general recommendation now, until we can watch this for a little while and see if people actually do get a little infection or not, the vaccinated people, the recommendation now is to be conservative and to keep wearing your masks if there are unvaccinated people in the room.
Jim, this next question is from Pam Snyder. Is there a preferred vaccine for those who have experienced anaphylaxis?
Right now, the recommendation is get whatever vaccine you can. And having spent the last 3 days on the website in Massachusetts trying to get an appointment for vaccines and realizing how difficult it is, I think that's good advice. Get whatever you can. The rates of anaphylaxis are extremely low. There's been, for example, with Pfizer, in a study that was done with 2 million people, there were 21 cases of anaphylaxis, and none of them serious. It happens in people who are allergic to any of the components of the vaccine. As for people who are allergic to other things like bee stings, they recommend that you stay after being vaccinated for 30 minutes instead of 15 and be watched, and to bring your EpiPen with you. But there hasn't been much anaphylaxis, so I don't think that would be a concern with either Moderna or Pfizer, and the Johnson & Johnson data looks good as well. Remember that the Moderna and Pfizer vaccine have been given to 45 million Americans, no deaths. In fact, relatively little side effects. Yes, you get a sore arm, and with your second shot, you might get a fever for 24 hours, but that's if you think of the numerator, And the denominator is 45 million people who have been vaccinated, 65 million people in the world in general. So very, very few problems with this. And if you have anaphylaxis, they ask you about it and they'll watch you, but it's not contraindicated right now.
Okay, Jim, I have another question from Nancy, actually a few of them from Nancy McKenzie. What are the differences among the available vaccines? Which vaccine is preferred or the best? For someone over 65, when will the vaccines be largely available?
Okay.
When should a person...
Let me stop you there, okay?
Okay.
We went over the different types, messenger RNA, Pfizer and Moderna, and Johnson & Johnson's adenovirus hybrid. People are looking at the data and saying, oh, Johnson & Johnson is only 70%, but it's only one shot. In addition, Johnson & Johnson is saying, we tested ours recently, and the reason it might be a little lower is because it was facing variants that the Pfizer and the Moderna, when they were tested, those variants weren't around. So again, what's important right now is to get any vaccine in your arm. I wouldn't try to go shopping for this one or that one. There's not that much difference. So the general recommendation is just get something in your arm as fast as you can.
Okay, Nancy asked one more question. Is Dr. Fauci the best person for giving the facts, and why?
Well, I worked with him for over 20 years and knew him for over 40 years. And knew him personally well as well. He graduated from Holy Cross, where I graduated from as well. And so we've had a personal relationship. He's as honest a person as you'd ever meet. He's a medical nerd, if you will. He's worked for many presidents, been given the National Medal of Honor by President Bush. His first challenge was to work on HIV with President Reagan, and now recently with COVID with President Trump. So he's done very well over the years, and I think you'll find him a straight shooter. And I don't think you'll see him. He's not a political appointment. He's a government employee who's been there for many years and will be there. And so I think he's a reliable source, as are others that you see on TV. Mike Osterholm, that you see often. Paul Offit, who you see with vaccine a lot. Both of them you might see in there. And I thought this Sanjay Gupta, who's a reporter, has done a good job. So there's lots of good voices there. And Tony's certainly one of them.
Thanks, Joe. Also, we have one on the chat line from Susan. Which vaccine are you and your family going to get? And having the virus and been hospitalized, when should I get vaccinated? I had remdesivir.
Interesting questions. Okay, I was lucky enough to get I'm over 65 now. They opened that up in Massachusetts. I was lucky to get an appointment at a CVS, and they gave me Moderna. I would have taken Pfizer or Moderna, whichever one. Johnson & Johnson's not available yet until next week. Rhonda's still trying to get an appointment, and so she hasn't gotten anything. My son's in the Navy. He got Pfizer. He's a Lieutenant JG. And my two daughters, one of them is a nurse practitioner, and she got Pfizer. And the other one works at KPMG and doesn't have any conditions, so she's still waiting in New Jersey. As for those people who had it, it's an interesting and important question. Most viruses, other than coronavirus, but most viruses, you get them and you have a long-term immunity. Not so with coronavirus, unfortunately. It appears that you can get reinfected even after you develop antibodies after natural infection. Now, when we vaccinate, we do something different than natural infection. Natural infection is through your nose, and we vaccinate in the arm with a much larger dose of the antigen and in a different spot. So and we do it twice. So it's very possible, and it's probable, that we can actually induce with a vaccine better immunity than those people who recovered from natural coronavirus. Therefore, the recommendation is that those people get a vaccine when they can. Usually, I've seen it, people say wait about 90 days. If you were taking an antiviral, remdesivir is an antiviral, it's probably out of your system now. If you were taking a monoclonal, as President Trump was given, that stays in your system much longer. So the general recommendation is 3 months after you've been infected, that's when you could to look for a vaccine. But with a natural infection, the immunity developed from a natural infection, and then the immunity developed in your arm, you'll be in pretty good shape from an immunity point of view, I think.
Thanks, Jim. Is another one from Stephanie. Is it important for a person to understand the condition of their health and possible resistance to disease, as it appears from recent data that the antibodies are not necessarily related to successful outcome to the virus? And does gender play an important role in determining the strength of the result of the outcome? What is the single most important factor, natural or behavioral, a person should consider in this day and age of SARS, as I'm sure there are more SARS on the way, how to deal with these genomes? Say I'm stranded on an island, short of isolation. What's the single most important factor towards a successful outcome with meeting the virus?
Okay, another easy question from Stephanie. Let's break this down a little bit. So the tried and true public health messages that everyone's been giving you about washing your hands, keeping your hands away from your face, keeping social distancing, wearing a mask, all would be good things to continue if you were worried about coronaviruses, or if there is another epidemic or pandemic. And it is likely that there will be more of these pathogens in the future. As for gender, no, it doesn't appear with the Moderna and the Pfizer data that there was any difference between male and female, or any difference between elderly folks, a little bit less in elderly folks than in younger folks. Neither of them were tested in children. Moderna is doing has started a trial in children 6 and older just recently. As for things you can do, there's keeping yourself healthy, obviously. There's been some recent data that getting enough sleep is important. There's been recent data that keeping your intestine filled with the appropriate antibiotics. You've probably seen a lot of that, probiotics and advertisements, but there is some data that's important. And a well-balanced diet, and as you get older, a vitamin or a multivitamin or a multimineral. So general things that you do to keep your immunity up. That would be the way to protect. As for the future, when we think of man's predators, we think of things like great white sharks or saber-toothed tigers, but the predators of mankind are really these little germs, these little pathogens. And that's what we're seeing now. There are more of them out there. Influenza, you remember 100 years ago, the Spanish flu during World War I, 1917-18, was an enormous killer in the world. We're waiting for influenza to mutate again and come back. It's on the horizon. We're worried about it. We're trying to develop vaccines universal vaccines that would protect it. We're trying to develop antivirals to protect it. And now it looks like there might be other coronaviruses coming. They're already talking about making universal coronavirus vaccines, trying to make it so you'd be protected about anything that will come. But diseases do emerge. They've emerged forever and ever and ever. There have been plagues. If you go over to Europe and go through many of, you'll always see a monument to the plague of 1390 or the plague of 1580. So this has been with us for a while, and these organisms, as we find ways to control them. For example, with bacteria, we found penicillin. So what did the organism do? The bacteria develop resistance. So we develop more antibiotics, and it's going to be a constant battle with these pathogens, these organisms, forever.
Jimmy, you may have answered part of Diane Timmick's question. However, the second part, I don't think. In your opinion, will we be facing this novel coronavirus for years to come? How well will the Pfizer and Moderna vaccines deal with the UK and South African variants?
Okay, very important question. So these are RNA viruses, and they are mutating all the time. But by far, most of those mutations don't mean anything. Every once in a while, one of the mutations will change the structure of the virus. That's what's happened with the UK and South African and now the New York variant. It's changed the spike protein a little bit, not a lot, but a little bit. And that has evidently given it an advantage in the world to transmit faster and faster. And so it's slowly taken over as the most predominant strain. The vaccine looks like it protects it. So let's say there's on a scale, if we measure neutralizing antibodies, let's say you have a titer of 640, and you need about a titer of 20 to protect yourself. Most people get 640 against the native virus. These variants, if you tested them, they'd come in about 120, 160. So there's still plenty of cushion, plenty of room to protect us against these variants. Will that be it forever? I don't know. We're worried that one of these will change the spike so much that the antibodies won't be protected anymore. So the key to that, and the key worldwide, is to not let the virus replicate. The more we've let it replicate, the more we've let these epidemics get out of hand, the more chance it spins off a variant. So the key is to get everybody in the world vaccinated so this virus isn't replicating often, and when it's not kicking out variants. That's why it's important for us to get everybody vaccinated, and for the World Health Organization to get involved, and other agencies, and to throttle down this coronavirus, because we just can't let it keep replicating and putting out variants, because one of these variants eventually might be a problem for us. Now, the good news is that both the Pfizer and the Moderna vaccine can be changed very quickly. All it is a piece of messenger RNA. And if you got the new variant, you'd take the old RNA out, you'd put the new RNA in, and off it would go. So it has a tremendous advantage in that way. You'd still have to have some testing, but Moderna has already started testing a new vaccine against the variant. So it would be against the early strain, the standard strain, and then also against the UK variant. So the tools that we have will allow us to change quickly, but the key is, let's get this virus under control. The less it replicates, the less threat it is for us in the future.
Jim, I have another question from Corky Thompson. Is there any correlation between age and reaction to second dose of vaccine?
No, that's been looked at. There's no statistically significant difference, but there is a little trend that older people have more of a reaction. Now, it's not bad to have that reaction. it means that your body is responding. So a little soreness and a little redness and a little swelling is actually good because it's saying that your body is responding to that and making antibodies, and the same for the reaction. Most of the time, people just stay in bed for a while and can get over it in 24 hours. There is some concern about, and I guess we could talk about it here, about whether you should take aspirin or Tylenol or ibuprofen. A lot of people have decided to take it before they go in to get a vaccine because they don't want the pain of the injection. Theoretically, that's not a good idea. Why? Because let's take Tylenol. It actually prevents inflammation. Inflammation is a part of the normal response of your body and the immune system. So you don't want to get a vaccine when you're already holding down or holding back the immune response. If you did that, just go ahead and get your booster. You'll probably be fine. But it's not recommended to take Tylenol or ibuprofen or aspirin or whatever before. After, if you really need it, take it because the immune system will have already started, 10, 12, 14 hours later. But even there, if you can avoid it, it's better off not to do it. Just let the system, for the first 2 weeks, let the system function in its normal way. Same actually applies to alcohol too. Not too much alcohol. Alcohol is immune suppressing.
Jim, the next question is from Andrew Newhouse. Could you please address children and COVID-19? At what age should children be vaccinated? Of course, I'm not permitted to be vaccinated.
Right, as I mentioned, Moderna has started a vaccination study with the lower age being 6 to 12 years old. So we'll have some data on that pretty soon. Children seem to be more resistant to catching coronavirus, but not totally, as we've seen. And there's been some horrible cases of children being extremely sick and dying. So it's not complete immunity, but they seem to be a little bit better at warding it off than older folks. Obviously, this is a central question for getting the kids back into school that everybody wants to get the children back in school. And you're seeing a number of papers coming out now, and a number of states are taking new approaches. Thankfully, in the last 6 weeks, after the Christmas spike, most states are seeing a decline in cases and are starting to open up a little bit more. And I think you'll see schools in many of those states where there's less and less disease opening up.
Thank you, Jim. The next question is from Patricia Murat. I understand that this vaccine is a short-term antidotal. It's a vaccine that we may need to re-up annually or every few years versus the lifetime polio shot or the childhood mumps shot that weakens as you get older. What can you tell us about this? How will the U.S. manage the situation, particularly with so many fearful or disbelieving?
Well, that's a good question as well, as all of these have been. We don't really know whether you're going to need a booster. We get a booster each year for influenza. So I think it will be possible to vaccinate boosters. It won't be all at once. It'll be over a period of a few months. And so maybe there won't be as much strain on the system if we do need boosters. As for getting older, what we've recognized is that some of the vaccines that we thought gave us lifelong protection only give us 30 years or so. As you get older, just like your knees start falling apart and your hips start falling apart, your immune system starts falling apart too. And so the immunity that you had when you were a child and are carrying on slowly decays. And now they're recommending for older folks boosters with some particular vaccines where they've seen this decay. Other vaccines seem to stay up, but not all of them. I think that the booster that we'll need for coronavirus will be more to address variants than it will be decaying antibody with age. But I wouldn't be surprised if we are going to need boosters. And it really has pointed out, as we've tried to vaccinate, this is a very difficult thing. We haven't done this sort of mass vaccination ever before, and the closest we've come to it is probably vaccinating against polio, that some of you might remember, or even smallpox, that some of you might remember. But our public health systems have been deteriorating over that time, and people have been forgetting how to do it, and with costs, the number of laboratories have been cut down, the number of people have been cut down, and that infrastructure is what we're relying on right now. We've got to build it back up. Once we do that, I think that boosters will be easier than this initial round, but I wouldn't be surprised if we need them. I guess the other part of that was vaccine hesitancy. There is significant vaccine hesitancy. It was well before coronavirus. There are a number of senior actors and actresses and people who are have the media who are advocates of not vaccinating. It's a significant concern, and if we can't vaccinate everything, will we ever get to herd immunity? And herd immunity would allow us to control coronavirus so that there'd only be a few hundred cases a year and we'd go back to normal. So vaccine hesitancy, people are scared. People have made people scared. A lot of the information that's out on the internet is not true. For example, that it causes autism. There have been 28 major studies in multiple cities that have and countries that have shown that that isn't the case. So there's a lot. The internet is sort of the Wild West. Anything's out there. I'm scared that this has put some fear into people. The vaccine hesitancy. I've seen some of the videos. They're very slick and polished. And they take a little bit of truth and then they exaggerate or twist that truth. So most vaccines are very safe and have been safe for years.
I have another question from Pam Snyder. Where can one find good statistics for COVID deaths? I ask as there are some who believe that the statistics for COVID deaths are exaggerated, that many really died from other ailments.
Yep, that's an interesting question. So some people say, okay, let's say you have breast cancer and you've been it's had it surgically removed and you're living with cancer, and COVID comes along and you get hospitalized and intubated and die. Some people say you died of cancer, you didn't die of COVID. I don't think so. If COVID hadn't come along, you would still be living with cancer for many more years. So that was one of the arguments that some people had. As for other people said, oh, a hospital gets more money if it puts COVID on the death certificate. Death certificates are legal documents that are looked at by insurance. They're the ultimate measure of the person's dead. He's not alive anymore, he's dead. So if you look at the last 20 years of deaths in the United States, it's almost constant at about 2.5 million a year, just nice and flat. And then you look at 2021 and it jumps up by about 400 or 500,000. I think that's the ultimate answer right there. Something caused, and it's COVID, I believe, caused those excess deaths, those excess death certificates in those people that are dead. And it's easy to follow through on those death certificates and see if the person's alive or dead. So So just by looking at the total number of deaths in the United States, it's gone up actually more than the number of COVID cases, which probably indicates that we're undercounting COVID cases.
I have a question from Susan. If I take aspirin every day, should I discontinue that before I get vaccine? And if so, when should I discontinue it?
Okay. A lot of physicians recommend taking a baby aspirin every day. I have been, the latest data indicates that it will help prevent a second stroke or a second heart attack. It doesn't necessarily prevent the first one. The only concern you would have is that you might bleed at the site of injection a little more. So some people are saying, why don't you stop taking it for a few days before the vaccine and a day or two after and then start taking it. But it's a very, very low dose and there's no major risk. The same applies to if you're on blood thinners. Many of us are on blood thinners. They recommend just stopping it for a few days before. They'll ask you this, and if you stop it a few days before and then start it up again, I'd check with your doctor if you're on, if you have a question on either of those. But general feeling is with aspirin, it's not a major problem. You might bleed a little more. With blood thinners, if you stay off it, but you ought to check with your doctor to see if he'd recommend that or not.
And Deborah Dunham has a question for you, Jim. After second shot, what time frames are we looking at to venture back into society?
Okay.
I know it's not an overnight miracle, she says.
Well, there's good data coming out now that indicates even after the first shot, you have considerable protection. Not maximum, but enough protection to prevent you from getting clinical disease. Does that mean you shouldn't get the second shot? No, you want maximum protection. So if you look at the graphs of the development of antibodies, at about 10 to 12 days after the first shot, you can measure a goodly amount of antibody. And then it goes up after that and levels off until the second shot, and then it spikes up again. So I would say that within a week to 2 weeks after your second shot, you could consider yourself fully immunized.
Does the COVID vaccine contain a microchip?
All right, this is another interesting internet. It's, as you know, Bill Gates has put a lot of money into vaccines in his charitable organizations. It has not been in the development of vaccine, it's been the application of vaccines. How do we get it into arms of people? And so there's some folks who are, and he also has worked on microchips and implantable microchips with a company. So people have put that together and said, there is a microchip in the vaccine that allows Bill Gates to know exactly where you are. There's no truth in any of this. He wasn't involved with the development of these vaccines early on. And, you know, it just doesn't make a lot of sense. We're all carrying around a phone that not only tells people where you are, but probably tells people more information about you than your mother and father know about you as well. So just knowing where someone is seems like it wouldn't be possible. So there's no truth in that. And if you look at some of the sites that say this, you can also go to other sites that go through the whole data and show that he has not been putting microchips into any of these vaccines.
Can mRNA vaccines change the DNA of a person?
Good question. Messenger RNA is a normal component of the cell's cytoplasm. It's made in the nucleus from the DNA, comes out of the nucleus. You remember your basic biology. There's a nucleus in cells and a cytoplasm around it with a nuclear membrane. Messenger RNA is made by DNA in the cells normally, comes out into the cytoplasm where it makes proteins that are pushed out of your cell and are used throughout your body. When you get a vaccine with messenger RNA, it never travels backwards into the nucleus. So it's never anywhere near the DNA, and they're different and couldn't cause a insertion into the DNA anyways. DNA and DNA does that, but not DNA and RNA. So no data for it. It never gets into the nucleus, where the brain of the cell, never even gets close. And as I said before, RNAs are very, very, very difficult to keep for more than a small amount of time in the cell, because the cell wants to break these down. It doesn't want, once let's say it's making a protein that you need for your blood, it wants to make it and then get rid of the RNA, doesn't want it to keep making it and making it, making it. The cell has to make other things. So it has enzymes that'll tear apart that messenger RNA after its usefulness. If you need it again, the DNA will turn on and make some more RNA, but RNA is very fragile in the cells, and so it wouldn't last even long enough to be a problem.
We have a question from Martha Crawford. How does one glass of wine the day of the second shot affect immune response?
There is data that says that drinking lowers your immune response a little bit. I think most of the studies have been done with people who are drinking way more than one glass a day. So I wouldn't over exaggerate that, but I certainly wouldn't go on any major drinking episodes while you're trying to get your immune system to be as healthy as possible. Probably one glass is fine.
Okay, from Diane. I've heard that the lipid component of the mRNA vaccines is a scarce resource, which has slowed down the production of the Pfizer and Moderna vaccines. Why would this be? Can you explain, please?
Yes, that's true. These are very purified little balls of soap. Think of them that way. And they're made of things like cholesterol and polyethylene glycol. Polyethylene glycol is in almost everything, including antifreeze. You'll hear that. But it's a lipid that's used in food and everything. But these are highly purified and carefully made to make sure that they have the exact right structure. So they're not available in a number of spots. And this is one of the concerns that people have had. Can we improve our vaccine supply in any way by increasing the availability of the structural components? So yes, there is a limit on that. I know that everyone, the companies are looking at it. I know the government is looking at it and has talked about using the legal powers of the Wartime Act, I think it's called, to increase if needed, to increase the production, to force a company to make more of the resource that's needed by the vaccine manufacturers.
Mary asks you, is there any evidence that people with autoimmune diseases like rheumatoid arthritis have a unique relationship with coronavirus or the vaccine?
No, not yet. We're still learning, but there's no contraindication that you shouldn't take the vaccine. And it's not on the list of medical illnesses that could make coronavirus worse. You've seen on that list heart conditions, you've seen diabetes, you've seen obesity, you've seen cigarette smoking, but arthritis isn't on that. Now, You might want to talk to your doctor, because oftentimes when you have arthritis, your doctor puts you on an immune suppressive drug. And so if you were trying to develop an immune response to coronavirus and you're on an immune suppressive drug, maybe that would be something to talk to your doctor about before being vaccinated.
Another question, if I don't have side effects after the vaccine, does that mean the vaccine did not work?
Most of the people don't have it and do get a good antibody response. So good question, but no, you're fine. If you do have a little reaction, then you can feel even a little better.
What if I can't get the second dose on time?
They currently recommending 4 days and before or after, so an 8-day window to try to get it. The studies that were done to develop it were done on 21 and 28 days. But with other vaccines, when you get the booster, there's more flexibility. I think that we will eventually realize that, and our window will be more than 8 days around the recommended date. If you can't get it, I'd just take it at the earliest opportunity after that. That's a concern with two-shot vaccines. Are people going to come back for the second shot? And that's always a concern when you have a two-shot vaccine, which is why the Johnson & Johnson, would be a nice vaccine because it's only a one shot. But try to get it within 8 days, one way or the other, of the recommended date. And if not, try to get it as soon as you can after that. But don't say, oh, because I missed it, I'm not going to get it. I'm sure it'll still be a good booster for you, even if it's beyond that 8-day window, one way or the other.
Should we get tested for antibodies after being vaccinated to see if we do in fact have them?
Well, if you think of it, 95% of the people are protected, but 100% don't die. And so probably everybody develops something. You can look at 95% as well. 1 out of 20 people, that's 5%. 1 out of 20 people weren't protected. The other way to look at it is 19 out of 20 people were protected. So I don't know. If you're very worried about it, you could go get an antibody test. But I don't think it's going to be recommended. I think we're going to assume that everybody who got their full 2 shots is appropriately immunized. So if you're really worried about it, there are places you can go and they could test it. One of the problems is they don't usually give you a titer. They don't tell you how much you have. They just tell you whether you have it or not. So, but in general, I don't think we're going to be recommending that. That being said, it's possible that to travel, you'll need to show that you've been vaccinated with some sort of document. And if you don't have that document, they might recommend that you either be tested for having the virus or tested for the antibodies at that stage. Hawaii is being very, very, very strict they're an island nation and should be about their travel restrictions. So it's possible that that there would be a place for an antibody test there to prove that I did have the vaccine. I lost the certificate, but this shows you that I have antibodies, that sort of thing.
I am currently taking antibiotics. Can I get the COVID vaccine?
Yep, there's a little bit of there's no concern with antibiotics. There's been a little bit of concern that if you're taking antibiotics for a disease or an illness, you should really wait until the antibiotics have cured that illness before you get the vaccine, because many illnesses will suppress your immune system. So if you're taking antibiotics because of a bacterial infection, maybe it would probably be recommended for you to wait until those antibiotics are done, wait until the bacterial infection is controlled, and then take it. However, it's so hard to get an appointment that if you have one, you might want to think twice and talk to your doctor about that. But it's not a major problem in most cases.
Once I've been vaccinated against coronavirus, am I exempt from the lockdown restrictions?
Right now, no, you're treated as if you haven't been vaccinated. However, there are a number of states looking at that, including Hawaii, and they are anticipating that in April or May, they will come out with a recommendation that if you can prove you've been vaccinated, then you don't have to go through the normal quarantine. Now, remember earlier we were talking about if you're vaccinated, you might get a little bit of it and spread it to somebody who isn't vaccinated. So you still have to be cognizant of that. If you were to go to a party where most of the people weren't vaccinated, you'd have to be worried about that. But many of the states will probably say if you've been vaccinated, you don't have to do the quarantine. So some of the restrictions at least will probably be lifted.
How long before a corona vaccine takes effect? Like once you get your first one, and then what about your second one?
All right, well, as I mentioned a little bit earlier, in about 10 or 12 days after the first one, you can measure antibody. And there's been some data that says that during that time, you have some immunity, but with the second shot, you get maximum immunity. And I would say 7 to 14 days after the second shot, you're probably at a very high antibody titer.
And why do I have to take the same vaccine if taking two different ones, like a Moderna and a Pfizer, for the second one? Would that make it any better, the efficacy or the effectiveness?
They don't recommending it because it's never been tested. It's because of the way the vaccines are rolling out. I think it's going to happen, and then we'll have some data. Again, the Pfizer and the Moderna are very similar. Not so with the Johnson & Johnson, it's separate. So the recommendation, because we only have data for Moderna, or Pfizer, but we'll probably be getting data of mixing. And I wouldn't be surprised if it's fine.
What if I can't get my second dose on time, Jim?
That, again, they're recommending 4 days, one way or the other as a window. And if you can't do it then, I'd get it as soon as I can after that. With other diseases where you need a booster like this, whether you get it at 1 month or a month and a half or 2 months, usually doesn't make much difference. We don't know that here. We will generate that data, but even if you're a few days off, that won't make any difference. It really won't. You'll still get a nice booster effect.
Do the COVID vaccines contain a live virus?
No, as we were talking about earlier, the old methods of making viral vaccines, growing it up and putting formalin in it and killing it, or growing it to make it weaker and attenuated and giving it to you as a live attenuated, that's not part of this at all. One of the Chinese vaccines is like that, but the Moderna and the Pfizer and the Johnson & Johnson don't have any virus in them at all. There's no way you can get a virus from it. It only has a little bit of messenger RNA for the spike protein. So the only part of the coronavirus that's going into you and that will elicit antibodies is the spike protein, not all the rest that you need to get a regular infection. So no problem at all.
Does the mRNA vaccine cause fertility issues?
No, that's been on the internet as well. There's no data at all about that. One of the big questions is, if I'm pregnant, can I get it? The recommendations now, nobody that was pregnant was included in the trials, but some were pregnant and didn't realize it or became pregnant after. There were no consequences. These messenger RNAs, because they're not live virus vaccines, which you'd worry about, or even killed virus vaccines, because they're not, the recommendation is that you talk to your doctor and that most pregnant women should get it, because if you are pregnant, you have a chance of getting an increased chance of getting a worse coronavirus disease. So the risk-benefit ratio is there, but we don't have that study. It is being done now. They're testing volunteers who are pregnant now. Most vaccines are not tested on pregnant women because there's an ethical challenge there. And what has happened with like rubella vaccine is that people who were pregnant accidentally got it, and then they followed them and found out that it didn't cause any problems. So it's no fertility issues and probably nothing with pregnancy. Check with your doctor, but the recommendation is that you go ahead.
Jim, thank you very much for answering all these questions. And everyone, I want to thank you so much for participating in our second webinar for AASH. We're so excited. And this webinar will be on YouTube, so you can see it again or share it with friends on the AASH YouTube channel. And I'm getting a message saying that our next webinar will be the tour of the shrine at Grand Couteau. So please stay tuned for the third webinar, and everybody will be invited, and we're all excited to see that one. So thank you again. Good evening.
Everybody should go out and get their vaccine if they want to, and if they think it through and desire it. When I was getting at the CVS, they said, "Do you want your Fauci ouchie?" So go get your Fauci ouchie shot.
Thank you, Jim. And good night, everyone. Thank you.